to terms with being transgender can be the achievement of a lifetime, but it can also set someone up to be a target for discrimination. Discrimination that can be compounded by race. The latest U.S. Trans survey shows that 42% of black trans people have experienced homelessness, 53% have experienced sexual assault, and 34% poor health care. To combat all of those ills, Sacramento's Gender Health Center is reviving an old program. Jasmine Bright, the co-executive director of the center and the director of healthcare service there, joins me now live. Good morning to you.
Good morning.
First, Jasmine, for anyone who's never heard of the Gender Health Center, please give us a brief breakdown of what it is and also what it means to be transgender.
What it means to be transgender is it means to be resilient and to be strong and to stand firm in who you believe that you are. And as far as the Gender Health Center, we provide mental health services, HIV healthcare navigation. We provide respite for those who need a place or a safe space to come. We also provide advocacy with a range of different services and mental health support.
I just ran down some really devastating statistics about factors touching the lives of many black transgender people. Why is it, do you believe, that things like homelessness and victimization in several different forms comes for this population more than other transgender individuals?
Well, transgender people experience high rates of violence and food insecurities and homelessness and more due to the fact of them not feeling accepted or respected in society or having access to the things that you mentioned, jobs and healthcare. So most transgender people are always in survival mode, trying to access the main things you need to survive in life.
This month, Black History Month, the Gender Health Center is reviving its Black Trans Power Fund. Now, what is the fund supposed to do? Why did it wane? And why is it so important to bring it back now?
So we ran this fundraiser last year during 2021 during Black History Month. These funds were distributed to Black trans people. Although the funds only went through one round in 2021, the need never went away. Our Black Power Fund will continue annually after 2022. And so we're looking to just provide more cash and services for our trans community.
And when you say provide more cash and services, how do you decide how this money is going to be distributed? Is it just anyone who signs up? Are there qualifications? And how can people listening right now, if they want to, how can they help?
Sure. So the best way to help is if you can donate or fundraise for us and go to genderhealthcenter.org/power fund. Start a fundraiser, share our social media content, and uplift these efforts. And those funds, or you can find on our website. And these funds are to help folks pay their rent, get access to food, transportation to get to doctor's appointments, and just to meet some of their immediate needs.
And then the first round that you mentioned, how many people were you able to gift and help during that round? And is there a goal for how many people for this round?
So last year, I believe that we were able to help 10 transgender people. This year, we want to increase up to 20 people. And we look to do this fund biannually. So we look to do it twice a year.
Alrighty. And on this issue, raising money and acknowledging some of the problems affecting trans people, especially black trans people, a lot of people might wonder what the best way is to be an ally. Lots of folks may want to help and support, but are concerned about stepping on toes and maybe doing something in the wrong way when that's not their intention. So how to best be an ally?
It's important for non-Black allies to support Black community and Black transgender people in tangible ways. With this fund is a great way of showing your type of support. It can be the difference between danger, safety, and life or death.
And when it comes to the Gender Health Center, how many people are you servicing? And again, if you could run through sort of the programs that are there so people know how they can plug in and really get the resources that do exist in our community.
So we serve, in our hormone clinic, we are serving over 500 patients to get them access to healthcare needs. We have over thousands of patients that come in for our needle exchange services, and we have hundreds of patients that are coming in receiving services for our mental health.
And you all also have a new location, right? A new facility?
Yes, correct. Our new location is 3823 V Street, Sacramento. The zip code is 95817. We are right on next to UC Davis Medical Center.
So we don't want anybody to think that you've disappeared just because they are not able to find you and when they last looked. So we wanted to get that in there. Thank you so much for
Correct.
coming
Thank
in
you.
to share about this fundraising drive.
Thank you so much for your time.